Emergency contraceptives are those methods which we use to prevent pregnancy after unprotected sexual intercourse has already happened. Now, the mechanism of action is going to depend on which of them we are using, and it is also going to depend on where we are within the menstrual cycle. Hi guys, welcome back to my YouTube channel. If it is your first time here, my name is Melody and I'm a registered nurse. Please make sure you subscribe and also share this video if you find it very helpful. Two things you need to know before we continue this video is that first, the sperm is able to be viable up to 5 days after sexual intercourse has happened. So if sexual intercourse happens today, the sperm inside the woman is still going to be alive up to the next 5 days. That one is one. The second one is that once the egg is released from the ovaries, they are viable for 12 to 24 hours, which is a very, very short period of time. And that is why if you're a woman looking to get pregnant or looking not to get pregnant, you're supposed to know your menstrual cycle because it is very short. So you can just be missing these 24 hours and the days preceding it every month, and then you wouldn't really know why you're not getting pregnant. So that is by the way. So those are two things that you need to know. For emergency contraceptive, we have two methods mostly, and the first one is the hormonal pills, and then we also have the IUDs, which is inserted into the uterus. For the emergency contraceptive pills, there are two different types. The first one I'm going to talk about is the levonorgestrel. I hope I pronounced that right. So these are like the older forms of the morning after pill. What they basically do is that they suppress ovulation from happening. For ovulation to even occur, there is something called follicle stimulating hormone, which is going to help to mature the eggs. And once this maturation is done, for this egg now to be released into the fallopian tubes, there has to be a sudden increase in what is called luteinizing hormone, which is released by the pituitary gland. So it is the effect of this hormone that will release this egg to enter into the fallopian tubes. Now, what this morning after pill will do is that it is going to alter this process. So it is going to suppress that luteinizing hormone so that that ovulation process will not occur. So levonorgestrel is basically stopping ovulation from happening. And also, because this medication is a progesterone derivative, another thing it does is that it also thickens the cervical mucus, making it difficult for the sperm to penetrate. However, if you are looking to use emergency contraceptive, it means that the sperm has already passed through. So this doesn't help. This is not helpful at all. This medication will not work if fertilization has already taken place. It will not work if ovulation has already taken place, and it will not cause abortion. So if you are looking to use emergency contraceptive, the best time to use it is immediately. So as the time goes, it means that your chances of getting that protection is going to reduce, because remember, if ovulation has occurred, it might not do much. It is not going to do anything for you. So the second type of emergency contraceptive pill is the Ella-1, which is derived from ulipristal acetate. Good luck with that pronunciation. So basically, Ella-1 is the most common one in this group. Just like we mentioned for the first one, it also helps to prevent ovulation from happening. So the major difference between the first one and the second one is that unlike the first one, after that luteinizing hormone surge has happened, it may not give you protection from pregnancy. But the Ella-1 is able to give you protection even after luteinizing hormone surge. After that luteinizing hormone surge, then the final process is where estrogen is supposed to increase and then prepare the body for pregnancy. Ella-1 is able to suppress those final processes, which is how it prevents pregnancy and gives you more cover than the first one. So again, just like the first one, it does not prevent pregnancy if fertilization has already occurred, and also it does not cause abortion. The next emergency contraceptive that is being used is the intrauterine device. So those are the IUDs, and the most one used is the copper IUDs. So basically, they insert this small T-shaped copper IUD into the uterus, and what it does is that it releases copper ions. These copper ions, they are able to like kill those sperms and make them not to be viable. And if they are not viable, they are not able to fertilize the egg. So that is what it will do for you. Another effect it has is that it has this inflammatory response, because it's a foreign object that is introduced into the uterus. It kind of have this immune response where the body is trying to fight it off. All of those processes it's not going to make it easy for the sperm to be able to fertilize the egg. And even if the fertilization happens, it's going to make it difficult for the egg to implant into the uterus. It's actually one of the most effective forms of emergency contraceptive, although it's a bit more invasive than taking the pills, but it's very, very effective. I'm going to recap. We have two different types of pills. We have the levonorgestrel and we have the Ella-1. So the levonorgestrel is able to give you protection before the luteinizing hormone surge, which precedes ovulation, happens. Meanwhile, the Ella-1 is going to give you protection even after the luteinizing hormone surge has happened. And also we have the IUDs, which work by killing the sperms and also creating an immune response, making it difficult for fertilization and implantation to happen. So I'm going to make another video where I talk about some of the mistakes people make with emergency contraceptive that make it ineffective. So please look out for that video. Thank you guys for watching, and if this video was helpful for you, please like, share and subscribe to the channel. Thank you. Bye bye.